Hi there. Here's something to think about. Did you know men are more likely to look after their cars than their own bodies? As we draw to the end of the year, I wanted to have this opportunity to remind people about men's health and why it's so important. So we'll be producing a few videos, and we're going to start off with testicular cancer. Men are 56% more likely to suffer with one of the following, and sadly 67% are more likely to die from them. Now, if you guys were on top of what's happening in our own engines as opposed to the one parked outside, we may see those figures come down, because many cancers can be preventable and most treated really successfully. Testicular cancer is one of the less common cancers and tends to mostly affect men between the age of 15 and 49. Typical symptoms you need to look out for is a painless lump or a swelling in one of the testicles, a change in shape or maybe even texture. That's why it's so important to have a feel of your testicles and understand what is normal for you. Get to know your own body, and if you are worried about any lumps, please speak to your GP. The different types of testicular cancer are classified by the types of cells the cancer begins in. The most common types of testicular cancer are known as germ cell testicular cancer, which accounts for approximately 95% of all cases. Germ cells are a type of cell that the body uses to create sperm. There are two main subtypes of germ cell testicular cancer, and they are seminomas, which are more common over the last 20 years and now account for about 40 to 45% of testicular cancers. And there are also the non-seminomas, which account for the majority of the rest. Now, the encouraging news is both respond really well to chemotherapy. So here's some other things we know and you should know about testicular cancer. It's relatively rare, only accounting for about 1% of cancers that occur in guys. Around 2,300 patients are diagnosed with testicular cancer each year in the UK. Testicular cancer is unusual in terms of it actually affects younger people as opposed to older. Although it's relatively uncommon, testicular cancer is the most common type in age groups between 15 and 49. For reasons that are still unclear, they tend to occur more so in Caucasian or the white population in young men. Almost all men treated for testicular germ cell tumours are cured, and it's rare for the condition to return more than 5 years later. Treatment almost always includes surgical removal of the affected testes. As a result of that, the outlook is one of the best. I hope this video has encouraged you to get to know what feels normal down there, so that if you ever feel anything peculiar or anything feels unusual, it's time to pay your doctor a visit. Thanks for watching, guys, and remember to like and subscribe to the channel. Take care.